Good afternoon. It's my pleasure to welcome you here today. I call the meeting to order. Let's have our roll call, please. We have one missing, Mr. Webb.
Yes, sir. I'd like to make a motion that we excuse Mr. Colson from the meeting.
I second.
All right, all in favor, raise your right hand. Let's all stand, please, and we will have our invocation and pledge.
Please bow your head. Dear Lord, we thank you for allowing us to make it into a new year, one that we've never seen before. We pray that you have blessed us to leave 2017 and that we will grow in 2018, that you will guide us, direct us, and keep us merciful unto your desires. All these things I pray for your people and us as leaders. In your name, Jesus says, amen.
Have you face the flag, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Are there any corrections or additions to the agenda?
Move the agenda.
No. Scott?
Yes, Mr. Chairman, we'd like to add an item to the agenda. It would be a resolution entitled Resolution Extending Date by which Pitt County Taxes may be paid without interest. This would be added to items to report under right after the tax collection report.
All right, so now, Mary, you got it.
Move the approval of the agenda with the changes.
All right, all raise your right hand. All opposed? So ordered. Let's see, Mr. Rhodes, are you first?
Good morning, Mr. Chair, members of the board. We have two public hearings for you this morning. The first one is for Woodmore subdivision road improvements. This should be your final action after dealing with this particular issue for well over a year now. The roads have been completed, and we're now in the portion of actually assessing the property owners. So just to remind you where we're at December 7th meeting of the Board of Transportation, the board formally assumed responsibility of these roads that have been improved, both Woodmore Drive and a portion of Trails End. Total cost that the county has actually footed the bill for was $106,627. And remember, there are 21 benefited property owners within the subdivision. You may recall through this process that we were, at this point, giving them a 10-year term on the repayment. That would equate to $507.75 per year for that 10-year period. So at your last meeting in December, you adopted a resolution declaring that cost and the preliminary assessment roll. Today, during the public hearing or after the public hearing, hopefully you'll be finalizing or confirming the final assessment roll, and all the property owners by statute have been notified of this hearing and are aware of the cost associated with these improvements. Just to show you kind of what we began with, about a year or so ago, this is what it was looking like. You can see we've had a number of partners involved. County Engineering Department's been instrumental in making sure that the contractor completed the work, of course, but DOT was heavily involved throughout the process. A lot of work going in, not just to the road itself, but to the drainage ditches or roadside ditches associated with the road. A lot of new material was brought in for the improvements to some of the bigger potholes. You can see the base course material brought in here. And this is some of the final work. You can kind of see the grooming. There were a few driveway tiles like the one shown here that needed to be replaced, as well as a portion of the driveway, the seeding that took place along the roadside as well. And here's kind of the final product. And again, this road was taken over by DOT just last month. So with that, our recommendations for action today: adopt the resolution that our county attorney has put in your package today, confirming the assessment roll for these road improvements. And also, we've begun discussions with our tax collector as far as publishing the roll, and we're asking that you direct him to publish that roll once this has been confirmed. So with that, Mr. Chairman, we're ready for the public hearing.
Having heard that, I declare the public hearing open. Do we have anyone signed up, Mr. Manager?
No, sir, we do not.
Is there anyone present that would like to speak at this time? If not, I declare the public hearing closed. What's the pleasure of the board as to the request for motion for number 1 and 2?
Move
Mr.
approval.
Chairman, move we approve both 1 and 2.
Second.
All right, any discussion? If not, all in favor indicate by raising your right hand. Thank you, sir.
Okay.
Okay, James?
We have a second public hearing. This is a rezoning request, and it is for conditional district rezoning. This is located on Barris Construction Road, south of this intersection with NC 33. And this is a request for rezoning from rural residential to general industrial conditional district. And remember, with conditional district, we'll talk about specific use, and in this case, it is for debris washout area that will be associated with the existing concrete plant. This was actually, we've mentioned from staff's perspective, we go out annually to look at some of these rezoning sites to ensure they're in compliance. At the time we went out to view this one this past year, we noticed that it had actually encroached into an adjacent area. So today's rezoning request, if approved, will bring this site into compliance. It is an associated use with the adjacent use, which is a concrete plant. Just to orient you as to the location, here's the intersection of NC 33 and Barris Construction Road. You can see this is the little site here is the Dollar General that's been constructed out at that corner. Down the road from there, the concrete plant being right here. And also, if you look real closely, you can see some disturbed area. That is the debris washout area that's actually encroached in an area that's not zoned for this particular use. Our existing land use survey shows most of it residential across the road, which is a mobile home park. There is one small commercial site. This is an industrial area where the concrete plant is located. And this is our land use plan, of course. It shows the types of proposed uses, and you can see the area either is in rural residential or rural agricultural. In this particular area, it is suburban residential, and this allows for a number of different uses, and including some light industrial. The locational criteria, which we meet on this particular request, would it has road frontage onto a major secondary road, and it is in close proximity with similar uses. And again, you can see this is a county zoning map. This is your existing industrial area. The area we're dealing with today, which is about 3 acres, is just adjacent to there. And again, this particular zoning district is primarily intended for a wide range of uses and would certainly accommodate the use we're dealing with today. The conditional district, this is very specific. It is for this one use and this one use only, and it is for a debris washout area. The engineer or the agent for the petitioners here today, he can give additional information about the washout area and how it's used if you'd like that. This is a blow-up of the area that is being considered. Again, right at 3 acres. You can see existing use is already there. We're trying to bring this into compliance, and basically this is an area where the trucks are brought in, the concrete trucks, whatever materials are left from particular projects, they bring in, wash it out here, and at some point in time, they actually bring in a machine to crush it, and that material can be used in other projects around the county. With this, staff has reviewed it and believes it is consistent with the land use plan. We believe it is reasonable in public interest as well. The planning board also reviewed this at their December 20th meeting and agreed with these recommendations. And so today we're recommending approval of this conditional district rezoning with two conditions. One is there is a riparian buffer based on some of the information from the soil survey, and we're recommending that the petitioner look at this and try to get it exempted if it is, in fact, no longer valid as being a 50-foot buffer. And this is just a small feature, really a hand-dug ditch along that property line. That is what's currently recognized as a 50-foot or riparian buffer area. Additionally, in this area, we mentioned there was quite a lot of residential development across the road. We're recommending vegetative buffers in accordance with our zoning ordinance along Bears Construction Road and also the adjacent residentially zoned property. And this is the area we're talking about in red, where it would begin here, mobile home park across the road from Bears Construction, and then also coming along this line as well. And with that, Mr. Chairman, we're ready for our public hearing.
Thank you, James. Sheriff, are there any seats available for those ladies back there if they'd like to have a
There's
seat?
3 right up, 4, right on the front.
There's some right over here and right there.
Thank you. If you'd like, you may stand if you want to, but thought it'd be a little more comfortable for you. All right. Having heard that, I declare the public hearing open. Anyone signed up to speak, Mr. Manager?
No, sir.
Is there anyone present today that desires to speak at this time? If not, I declare the public hearing. Okay, come around.
Good evening, Chairman, board members. My name is Ken Malpas, representing DPD Concrete. We'll be glad to answer any questions, but we're okay with the additional vegetation, and we've already applied for the riparian buffer to be looked at to
Any questions?
be exempt.
Mary?
I have one question that just came to mind. There's that ditch on that side. Will it be cleaned?
The one that's up for the riparian buffer,
Yes.
I don't think there'll be any reason to touch it. I don't think it really carries any water per se. That's why we're going for the exemption, because it's a very, very small ditch.
Okay.
And it just drains back toward the pond. I mean, when the pond was dug, that kind of cut off the original path that was carrying the water.
My concern is overflow, when the ditches are not as dug out as it should be. There's an overflow and cause some
Well,
drainage problem. That's what my concern is.
I got you. There won't be any much added as far as impervious area, because it's just a washout from this leftover in the truck, and then as James explained, when they get enough concrete, they come in, they crush it up. It's not really used for roads per se. It's used on farms because it's not suitable, because it's basically, remainder, so it's not consistent what you're getting.
Are you located at the Burroughs construction site?
It's right beside
I
the,
said, are you located at the Burroughs construction site?
no ma'am,
Okay.
no ma'am.
Just want to know because I'm
Okay,
stopping there.
thank you.
Any further questions?
I'd like to recommend, Mr. Chairman, approval with both conditions.
All right, Mary, discussion. Ann, excuse me, I still don't know who you are. Excuse me.
I'll second that motion.
thought it was
before
Floyd.
discussion.
With the debris or any hazardous materials there, that would
No, ma'am,
be-
it's just a leftover concrete from what is not used on the project. When you get back, I mean, you have to wash the drum out, and sometimes there's some left over, and that's just whatever time it takes to accumulate enough. He doesn't have his own crushing, and most concrete plants don't. They hire somebody, comes in for a week or two, crushes it, put a conveyor belt, and then they'll haul it out, and as people need it, they'll sell it off to farmers or whoever's using it because it's kind of a good thing that's recycling. It's not just getting buried like it was done a lot of time in the past. They're making better use of the material is what they're doing.
Thank you.
Thank you.
Anything else?
Okay.
If not now, if I haven't done it, I declare the public hearing closed. Now, Melvin,
I'd like to recommend approval with both conditions, please.
I second it.
all right, any further discussion? not, indicate by raising your right hand. All opposed, like sign. Thank you. Pam, Ms. Strickland? Yeah, you ready to do it now? All right, to expedite matters, we've got a resolution, it's been in your package. Does the board desire to approve that
I
resolution?
move that we
Yes.
approve it.
I second that.
All in favor indicate by raising your right hand.
Mr. Chairman, we prepared a resolution recognizing January 2018 as Human Trafficking Awareness and Prevention Month. If you'd like, I can read,
Please.
show the public what we'll be reading here. And as we've done for several years now, we've had representatives from Stop Human Trafficking in Eastern North Carolina come to our board, and we've done this. So let me read the proclamation. Whereas human trafficking involves the recruitment, harboring, transportation, provision, buying, or selling of human beings for their services of labor or commercial sex through the use of force, fraud, or coercion. Whereas human trafficking violates basic human rights and deprives victims of human dignity and freedom. Victims are dehumanized and forced into modern-day slavery. And whereas human trafficking is a growing global and national problem, with North Carolina being consistently ranked as the top 10 states for prevalence in human trafficking. And whereas it is imperative that we educate our communities, our young people, and families to take an active interest in learning how to recognize the risks and resist predators who use coercion and threats to manipulate children as young as 12 into labor or sex trafficking. Whereas in recognition of the need for that education, the North Carolina General Assembly recently enacted legislation mandating that sex trafficking prevention and awareness information be included in the sexual health education curriculum. Whereas every law enforcement officer in North Carolina received human trafficking training in 2016. Whereas in recognition of the importance of access to services, the North Carolina General Assembly enacted legislation effective January 1st, 2018, requiring that businesses post the National Human Trafficking Hotline. Whereas the Pitt County Coalition Against Human Trafficking seeks to eradicate human trafficking by empowering organizations and individuals through collaboration, leadership, and training. Whereas the Pitt County Sheriff's Office, the Pitt County Department of Social Services, Pitt County Schools, and many other organizations are active members of the Pitt County Coalition Against Human Trafficking. And whereas Pitt County is committed to protecting people vulnerable to human trafficking and taking action to end human trafficking through the prevention, prosecution, and partnerships. Now, therefore, the Pitt County Board of Commissioners do hereby proclaim January 2018 as Human Trafficking Awareness and Prevention Month in Pitt County and commend its observance to all citizens. This is adopted this 8th day of January 2018, signed by our chairman, Mark W. Owens, and attested by our clerk, Kimberly W. Hines. Mr. Chairman.
Thank you. Pam has done more individually and collectively than anybody I know to advocate and to go forth with the issues that we're talking about here today. Would you like to say something, Pam?
Thank you, Chairman. I would just like to say that we have been so excited about the support that we've received from organizations here in Pitt County. When we formed the Pitt County Coalition Against Human Trafficking, it was a fairly new thing. And as it said in the proclamation, you know, the support that we've gotten from the Sheriff's Office, from Pitt County Schools, from Pitt County DSS, as well as a lot of other nonprofits here in our area, we're very excited about that support, and we think we're definitely moving forward to address the issue of human trafficking here in Pitt County.
Thank you
We thank you for your support.
very much. Would you like to say anything?
Yes, sir.
Mr. Owens. Got, service awards next. Service awards next. We're going to move straight into the Employee Service Awards, and if Florida Hardy will come up to assist. We would like to recognize this morning, as we do on a quarterly basis, our workforce of Pitt County government in terms of their anniversaries of milestones of today we're doing 5, 10, 15, 20, 25, and 30. We're going all the way up to 30. Sometimes we exceed 30. We go 35, but not today. So as we call your name up, we will have a certificate for you and appropriate memento for you. The silver box represents, there's 2 silver boxes on the table, represents those employees who are at the 20-year milestone with Pitt County government. And at that milestone, the employee is able to select a watch to mark their time for the next 10 years. So we'll start with our 5 years. So Kimberly Alexander from Social Services will come forward. Michael Briley, Solid Waste. Terry Ann B. Burley, Social Services. Terry Ann, sorry. Candace Connor, Public Health. Pamela B. Ellis, Social Services. Jasmine George, Social Services.
Jasmine. I thought that's Jasmine.
Catherine Gonzalez, Social Services. Okay. Ashley Kelly, Social Services. Rebecca Mason, Social Services. Karen McWayne, Social Services. Ticole Murphy, Detention Center. And our last 5-year recognition is to Tasha Overton, Social Services. A round of applause for this group. In the tenure category, Catherine Acock, Social Services. Lynn Carter, Public Health. Eric Clay, Buildings and Grounds. David Flynn, Sheriff's Office. Susan Gray, Detention Center. Emma Holscher, Social Services. Thomas Knight, Social Services. Wanda Murphy, Social Services. Joseph Neal, Sheriff's Department. Valerie Pill, Social Services. Noel Slocum, Social Services. And our last 10-year recognition is to Christopher Sires, Sheriff's Office. Congratulations. Again, a round of applause. We have three 15-year recognitions. First, Teresa Mills in solid waste. She's here. Okay. Next person could not attend, Robert Taylor from Detention Center. And our third and last 15-year recognition is Tatina Worthington, Social Services. I think DSS is well represented here today.
I think so too.
Congratulations. Again, a round of applause for this group. Okay, 20 years, we have two recognitions. David Cherry, Buildings and Grounds. And Gail Haddock, Social Services. All right, round of applause for those. We have one 25-year recognition for Jacqueline Mills with Public Health. Round of applause for Jacqueline. We have one 30-year recognition this morning. This is an employee of the Pitt County Industrial Development Commission.
Is she here?
If one
Did she
day
make
you
it?
will come forward. Thank you. Congrats. Round of applause. You announce the reception? You want to announce the reception?
Yeah.
Go ahead.
We have a little refreshments in the back for the honorees, and everybody else is present today, so feel free to exit on my left and go back and enjoy yourself, and glad to have you with us. Thank you. Thank you for bearing with us. We are now back in session, and we're privileged today to have, I'm getting ahead of myself again, but Mr. Manager, do we have any signed up for public address?
No, sir, unless there's somebody in the audience who'd like to speak.
All right. Now back to my point I was making. We're very privileged today to have Dr. Michael Waldron from Vidant Health up for an update and annual report. Doc, come around.
Good afternoon. Thank you, Chairman Owens and Board. I appreciate the opportunity to give you an update to conform with the transfer agreement that was done many years ago. And I'd like to start by just giving you a little bit of an update about what's going on in healthcare. And if you watch the news or you read the paper, you probably realize on a national level and at a state level and a local level, healthcare is undergoing tremendous change and tremendous transformation, really unlike any time in the history, modern history of healthcare in the United States. And that's no different here than in other places in the country. And as we've looked at those issues, we believe that being successful and building on a really phenomenal tradition in Eastern North Carolina, the elements of success are strong governance, a very strong strategic plan, an execution against that plan, and building on a foundation of collaboration and connection to the communities that we serve. So I want to thank y'all for the opportunity to give you an update on where we are with those activities and appreciate the role that you play in appointing over 50% of our board, and we have a very strong board. I'd like to recognize the chairman of our board, Lawrence Davenport, is supporting me here today, but we are fortunate to have very strong commitment to our mission to serve Eastern North Carolina and to promote the health and well-being of Eastern North Carolina, and we take that charge very seriously as the largest nonprofit healthcare delivery organization in Eastern North Carolina. Also, I'd like to thank the partnership that y'all have given us, and I know many of you through different work in the community since I've been here just a little over 2 years, and I appreciate that partnership and support. And then I'd like to thank the chairman, Mr. Owens, for your incredible historic commitment to the community and to our organization, which sets us up for future success by creating the transfer agreement and the work this board did many years ago to help support us in meeting those important objectives. Last year, 2017, frankly, was an incredible year for us in that we never served as many people as we did in 2017. We had over 1 million patient encounters, which is really unbelievable if you think about the fact that we serve 29 counties, and that county population is just a little over 1.4 million people. So to have 1 million patient visits and encounters is just an incredible feat. And in that, our quality metrics, our safety metrics, our customer satisfaction metrics have never been higher. And so we were able to advance our objectives on being excellent as far as quality of services that we provide and making sure that our services are provided in a way that our patients and their families expect. We had a strong financial year in that we had a relatively strong operating margin, and fortunately the markets were strong last year, and we had good gains with our resources. We continue to meet and exceed the requirements of the transfer agreement. Those items that were set out in the agreement include financial requirements, one being the annual debt service coverage ratio of 1.5%. Currently we're at 3.98%, close to 4%. The annual cash cushion ratio must be at least 1.4, and we're fortunate to have a cushion ratio of 20. That we make an annual payment in lieu of taxes, and last year in January of 17 we made $1.89 million and expect to make 1.93 this year in January of 18. We continue to make payments on Medicaid reimbursement. Last year we made $640,000 plus dollars in January 27, and this year we anticipate making $651,000 plus dollars this month. We continue to support our communities with community evaluation for community needs assessments, and we continue one of the agreements, transfer agreement items to continue to support the school nurse program, and that continues to work well. And last year we spent $1.3+ million in support of those programs to help children in our schools stay in class and get proactive care. So we're excited that we're able to meet all of those transfer agreements. And as I mentioned, last year was a very good year for us, and we continue to execute against our plans. And as we look at 2018, we're very excited on what we have going on, in that you can drive a few blocks from here and see a new state-of-the-art cancer center. And some of y'all appreciate you coming and visiting with us and touring it, and I think you would agree when you saw that we really will have a state-of-the-art facility in Greenville, North Carolina, and I would argue probably one of the best cancer centers in the country right here. A highly integrated care delivery model that Greenville will be the hub for, but it expands across all 29 counties. Because cancer is an extremely high burden issue for all of our communities and as it is here in Pitt County. We continue to expand services and grow important services. Last year, our cardiovascular service lines exceeded expectations. Kidney transplants were at a record high. So we continue to grow important services that our patients and their families need. We're also excited about Project Unify. This is a very important project for ECU and Vidant Health. We feel very strongly, as does the university leadership, that we are better together in meeting a complex, changing healthcare environment, and that having the two largest physician groups together in how we plan to meet our community's needs is the way to be. And so we're in process of building that company and putting those two groups together. There's a lot of work this year that will be undertaken to make that happen in a seamless and respectful way, so we can meet the needs of our communities even better in the future and drive quality of care. And also we believe that it helps us drive economic opportunities and build on the past, which we can see where we've had good partnership that has led to good economic opportunities for our communities and our people and physicians and others that work in our organizations. And so we're excited about the opportunities that this brings for quality of care, expanding research, and helping us educate future physicians and nurses in a integrated delivery system that is structured to meet those changes that are going on in healthcare in the United States. We also are excited about our new technology capabilities and pushing care towards home, and how we have infrastructure and people and processes that allow us to take care of people in their home or as close to home as possible, and to try to keep them out of the hospital, because the hospital is not a place you want to be in. So we have a lot of exciting things that are going on, and that's a very, very high-level overview of some of the things going on. I'm happy to report we continue to meet the objectives that were outlined in the transfer agreement, and we continue to execute against our strategic plan. So with that, I will take questions.
Any questions from Doc? I think he's about covered it, and that's but if you want to have some personal relationship by asking him something, feel free to do so, members of the board. If not, Doc, Lawrence, step around, please. For all of those that have been here for 1,200 years, Lawrence has been a big essay, so to speak. That means from one end of the spectrum to the other. In fact, Lawrence was one of the group that persuaded Dr. Walter to come here and bring his expertise to us. But we do appreciate you too, Lawrence, as well as Doc. And I never give a man an opportunity not to say something. And I know you might be reluctant to do so, but can you enlighten us a little bit with your remarks?
Thank you, I appreciate that, Mr. Chairman.
To the mic.
First of all,
Mike.
First of all, let me say that we are very, very fortunate that we were able to bring Dr. Waldron in at this time to help us with this Project Unify. And Project Unify is probably the third most important thing that's happened to this medical center since its inception. Leo Jenkins, the inception, and then when you agreed to the transfer agreement and the private not-for-profit mode that we went into a number of years ago, and Chairman Owens and I were both deeply involved in doing that, and now Project Unify, which is the third step in making this medical center what we all want it to be for Eastern North Carolina. I can tell you we got the right guy to help us do that, so we're very fortunate in that. I really appreciate all of your support over the years. our medical center has just grown unbelievably. 1.8 billion now. In the first year I went on the board, it was like 300 million. So it's been a great ride. We have a wonderful asset for Eastern North Carolina. I couldn't be more satisfied with where we are today. Just couldn't be more satisfied. It's just more than I ever expected we'd be able to do. So thank you all for your support. It's been a good.
Thank you, Lawrence and Doctor. Appreciate you. Thank you, sir.
Nice to be here. Thank
Have
you.
a good day. Be safe. All right, Mr. Elliott, what's next?
Next, we have Dave Peterson to give a report on Trillium Health Resources. Mr. Peterson is the Central Regional Director for Trillium Health Resources.
You have that presentation? Is it?
He'll get it. I think I heard.
If staff can come help Mr. Peterson get his PowerPoint
I
up.
thought I
There we go.
heard somebody coming.
Good morning.
morning.
Thank you for having me here, and I just want to start by saying thank you to the chairman for allowing me to give my annual report this year. I'd also like to thank Commissioner McLaughlin. He serves on our board and has been very supportive of Trillium Health Resources the past couple of years. And so this is part of what the 2015 North Carolina Association of County Commissioners charged us as managed care organizations to help build relationships with county commissioners out there. And so I had the opportunity this summer to present at the North Carolina Association of County Commissioners annual meeting in Durham this summer, and that's my goal, is to make sure that folks are hearing what Trillium is doing out there. So thank you for having me. So for an update, first want to start with our mission, transforming lives of people in need by providing ready access to quality care. Sounds pretty simple. It really isn't, okay? We've had a lot of changes that have been happening the last 2 to 3 years in regards to legislation and with budget. And so one of the things that we have been trying to address is the reoccurring budget cuts that have come across, along with trying to make sure that we are adapting and evolving to those changes that have come down to us. So one of the things that we decided to do on November 15th, 2017, we announced an important step towards managing our care in North Carolina. We have partnered with 2 other managed care organizations, Alliance, which has 4 counties in the central part of the state, and VIA, which has 23 counties in the western part of the state. All right, so a total of 52 counties between the 3 of us, and basically you can learn more about that on the link on the website, advancingnchwholehealth.com. And the intent of this is not a merger, okay? The intent of this is when we are being asked to prepare for the Medicaid reform, we have a strong voice with having 52 counties now covered, okay? We will be one of the strongest when we partner with each other, but it's not a merger. I want to make sure folks are hearing that, okay? So here's where we were last year. We had 24 counties. This is information that I shared with you at last year's report. Approximately 185,000 Medicaid eligible individuals. We were about 13% of the state's population. And as you can see, square miles were huge, all right? From Virginia all the way down to South Carolina, the whole coast, all right? As you may see here, Wilmington and Greenville are our 8th and 10th largest cities that we cover, but we also cover the smallest county in the state, all right? And Terrell County is about 3,800 people, okay? That's about a dorm at ECU, all right? So One of the big steps that we made this past year was Nash County wanted to join Trillium. And so that made our total population 1.35 million and increased our Medicaid eligibles by about 10,000 people. And now that increases our total population of 14% and our 16% Medicaid eligibles. So now we're covering 25 counties. So every year we do an annual gaps and needs survey. It takes into all the demographics of the national information, the state information, and the county information. We try to make sure we do surveys with consumers that receive services and a variety of stakeholders. And this year we did much better than last year in getting almost 35% more consumers and stakeholders involved in the survey. We did it in a variety of ways through our consumer family advisory boards, online surveys, and then we compiled that information, okay, and put it into a gaps and needs report. And that gaps and needs report is now a link on the Trillium Health Resources website. So if you're interested in that, I'd be happy to take a look at that. So here was our statistics for 2016. We served approximately 52,650 people. 79% of those individuals were with those with the primary diagnosis of mental illness. 19% primary diagnosis of substance use, and 9% with intellectual and developmental disabilities. Total cost of services was $355 million. Okay, across the 24 counties last year. We have and we manage approximately 430 provider agencies in our 25 counties. Those are the folks that are really the day-to-day folks that are serving the individuals. Okay? So taking a look at what our priorities are, we want to make sure we're improving customer services. We're wanting to make sure that we're taking more of a closer look at evidence-based practices. We want to make sure that we're keeping up with technology, and in our industry, that's difficult at times, but we're trying to keep up with all the technology changes happening. We are really trying to make sure that we're one community together, and that's about building our local relationships. And we have a variety of meetings just in Pitt County that we attend, and Keith Letchworth, our system of care staff person, he attends probably 15 to 20 different meetings just in Pitt County. Okay. We also want to make sure that we're, the enterprise integration is making sure that all of our departments are functioning together. Because it's a large agency, and we have to make sure that we're communicating amongst each other. So one of the big topics that everybody has heard about is how we're trying to address the opioid crisis. So there was funding from the State Department of Health and Human Services, and it was called the CURES funding. Okay? It was $31 million spread across the state. All right? We, Trillium, got 1.2 million of that in the first year. Now, let me make sure, folks, here, it is only a 2-year grant. So we're going to get some more money this next fiscal year, all right, to address the opioid issue in our counties. And so it's very specific, though. It serves only individuals that are, have a primary diagnosis of opioid abuse. And it has to be someone that's either new coming into the system or has not had services in a while and needing to get into opioid services. All right. 1.2 million is what we got so far. Within the first 6 months, that 1.2 million was spent. Okay. In other words, we had a lot of individuals that had services, and we have served 1,269 individuals with a primary diagnosis of opioid abuse. All right. The really good thing that has been happening throughout our counties, and on December 5th, Pitt County had their opioid forum, and it was an excellent turnout, and Scott did a wonderful job pulling that together. 140 people attending that meeting. Okay, it was phenomenal, hitting on all aspects of the opioid issue. This isn't a hospital issue. This isn't a provider issue. This isn't a sheriff's department issue. This isn't a social services issue. This is a community issue. And it was a really good meeting of the minds to say, here's how we need to take a look at that. So some of the initiatives that we have done at Trillium to try to support the various counties is we have purchased some beds in Wake County, and we've had 354 admissions to the healing transitions in Raleigh. And that's a peer-led treatment facility there. We've also had Oxford houses, and Pitt County has a couple of Oxford houses, which 242 people have been served, and those are sober living homes. We also have a contract with the North Carolina Harm Reduction Coalition they distribute, we put money into their account, and they distribute naloxone kits to our law enforcement officers. Okay, and Pitt County has taken advantage, along with the police departments in Pitt County have taken advantage of that too. We've had 2,245 kits distributed. We've also set up wellness cities where people can come in and get some peer supports, and we have one in Greenville, Wilmington, and New Bern. And there's a lot of people that walk in and out of those facilities for different types of peer support. We're taking a look at our advancing technology. We have a comprehensive assessment for teens. We have crisis chat. Kids do not like to talk on the phone. They like to text. Okay, and so we have a crisis chat texting system set up for kids. All right. We also have funding that has been addressed for assistive technology, helping people at their home so that they do not need to go into a higher level of care, which costs a lot more money. We also have set up what's called kiosk access points in some of our smaller counties that don't have as many resources like Pitt County does. So folks can go in front of a kiosk and get a screening done for mental health. So some of our outcomes. We have had some respite programs, summer programs, and we've had 380 youth being served at those. And the after-school programs, we've had 218 kids being served at those. We've had, as you know, the accessible playgrounds. We have them in Pitt County, and we've got 30 of those throughout our 25 counties. One of the clinical sides is we've started Child First. We're the second state to implement that service, and that's a service for trauma that has happened in a home for kids 0 to 5 years old. Now, in talking with my partners at DSS, and I think Jan's left, this is one of the most important services to hit really early, especially with the opioid issue going on. There's a lot of trauma that has happened in the homes, and this is a clinician and a case manager going into the home and helping folks out deal with any trauma that's happened in the home. Okay. We have trained direct care staff to enhance the professionalism of a direct care staff, and we've had 647 staff trained on that. As you may have known, this is a 2 to 3 year project. It's now done. Rachel's Challenge, where Rachel was the very first girl that was killed in the Columbine shootings years ago, 18 years ago now. And this was one of these services that when they went into the Pitt County schools, they did a one-day training and then a follow-up training in the spring for trying to help the kids develop a more positive atmosphere in the schools. So Pitt County did an excellent job the school systems did an excellent job of implementing this program. I think we had 24 elementary schools and 16 in middle and high schools involved in that. We also had wellness recovery, which helps, their classes for people to deal with their managing their symptoms. And we've also had offered mental health first aid. I will also add on here, that's not on here, we have also added, and been doing it for years, and Keith has been part of this process, the crisis intervention teams that we've done with law enforcement officers, training them on how to, when they come onto the scene, if someone has a mental illness, how do they communicate appropriately with people with mental illness. So just the numbers for Pitt County. Total number of people served was 7,750 people just in Pitt County. 6,006 people with a primary diagnosis of mental illness. 1,497 people with a primary diagnosis of substance abuse, and 820 people with a primary diagnosis of intellectual and developmental disabilities. Now you'll see those numbers don't add up to 7,000 because people have dual diagnoses. Okay. I am now available for any questions.
Thank you, Mr. Peterson. I'm sure everybody is appreciative of your contribution personally and the organization's contribution, and how all of the people that you just spoke about have been affected by that. And what we all strive for is an advancement to improve those conditions and circumstances. Having said that, are there any questions from the board members? If not, we thank you and continue the good work, sir.
Thank you.
Okay, of course, the next item is self-explanatory about the appointments. Chris, the monthly financial report.
Good afternoon, Mr. Chairman, Board. The monthly financial report that's being given is as of November 30th. A little bit dated, but it is represents 5 months worth of activity for the general fund, which is approximately 42% of the fiscal year. The revenues that we have collected is right at 49% of budget, and we have spent 41% of the budgeted expenditures. In the revenue columns, taxes ad valorem is our main revenue source, and we're right in line with the last fiscal year at 66%. The dollar volume over last fiscal year is 2.6 million in comparison to fiscal year 2017. You'll notice social services revenues being down a little bit over $2 million. And the reason for that, the state has assumed the daycare process fully, and Pitt County no longer funds and gets reimbursement from the state on that. In total, roughly in line with last fiscal year, 48% from last year. On the expenditure side, general government expenditures up a little more than $3 million. But social services is down 2.4 million. So in total, expenditures up $0.7 million from last year. And if you look at the revenues versus expenditures, right in line with last year. And then one last note, our contingency line at the end of November is at $85.5 thousand. And with that, is there any questions?
Any questions, or do we have a motion to approve
Motion to
this?
approve.
Second it.
Mr. Chairman, if I can just add a
All
note.
right.
Chris was talking about the daycare funds that we had budgeted in our budget. The state has taken those over to process and pay those. That's how much money? 6-7 million? I forget the.
And we've also amended the budget to take those down.
Right. So since we've amended the budget, that will help us at end of year with our fund balance calculation as the percentage is calculated. So that'll be in our favor.
The base will be reduced by those funds.
Right. So that will help us.
Any further questions? Not all in favor of the motion indicate by raising your right hand. All opposed, so ordered. Next.
Next is settlement of taxes, is Raymond Revilla will come forward.
Mr. Chairman and Commissioners, the statute 105-373D requires a settlement of this nature when a tax collector voluntarily resigns, or in this case, Kathy Booker retired effective on January 1st. So the settlement is a summary of not just Pitt County taxes, but all the taxes that she was charged with back in July, just to show you what was charged and how much so far has been collected through December 31st, as well as our various activities of enforcement. Are there any questions about the report?
If no questions, do we have a motion to
I
accept?
so move that we approve the property tax settlement report.
Any discussion? Not all in favor indicate by raising your right hand. All opposed, like sign. Thank you, sir. What's next?
Next item, Raymond Revilla, tax collection report.
Through the end of December 31st, the combined rate for the fiscal year to that date is 83.97% for real and personal property taxes. 1 year ago, this rate was 83.29%, so that's a 0.68% increase, so we're still a little bit ahead of a year ago. The County Tax Administration continues to pursue all outstanding taxes using the necessary remedies that are available to us through the North Carolina statutes. These include bank attachments, wage and salary garnishments, sheriff levies, rent levies, the North Carolina Debt Set-Off Program, and the in-rem foreclosure program.
Any questions?
Motion to approve.
Second it.
All in favor indicate by raising your right hand. All opposed, so ordered. Thank you, sir. Scott, I believe you had something you wanted to insert.
Yes, Mr. Chairman, pass out a resolution to you. Basically, this is a resolution entitled, Resolution Extending a Date by which Pitt County Taxes May Be Paid Without Interest. Due to the fact that last week we were closed half a day Wednesday, full day Thursday, and half a day Friday, and property taxes were due on Friday, January the 5th statutorily, and also the fact that today we had a 2-hour delay. Staff is recommending, and we've consulted with the School of Government in Chapel Hill, that we have the ability to do this. They're telling us as long as the Board of Commissioners adopts a resolution and that the manager and attorney are in concurrence with this, that we can do this. We're recommending that taxpayers be given the opportunity to pay their property taxes for calendar year 2017 through business hours tomorrow, or effective through Tuesday, January the 9th. They would not then be penalized with interest.
Good overture. What's the pleasure, board?
I
Seems
move
very
that we
reasonable
accept.
to me, and I think that that is us focusing on the needs of the community, so I would motion that we approve this.
I second it.
All right, any further discussion? If not, indicate by raising your right hand. All opposed, like, so ordered. Okay, Mr. Manager.
Okay, next, on the manager's report, just your next meeting dates, January 22nd will be the annual CIP, which is your capital improvement plan workshop and budget planning workshop combined. And then February 5th will be your next regular meeting at 9 a.m. that first Monday of the month of February. I want to remind the board, you do have a joint meeting with the Pitt Community College Board of Trustees on February 21st from 11 to 1. You'll arrive a little bit early. They're going to load the board on buses to do a campus tour of the PCC campus, then break for lunch, and then have a presentation thereafter, and it should wrap up by
Where will this be?
1 o'clock. Jenna, do you know where you're to meet on campus? If not, we'll find out and inform the board
Yeah,
where.
'cause,
I think it's going to be at the GOED Student Center, but we'll verify that. We'll verify the location.
So we're to go as.
We'll
She's
call you
gonna let
in.
us know.
Yeah, we'll call you and verify. The only other thing I had on the manager's report is, obviously, we've had this storm event for the past 4 or 5 days. In terms of snow removal, I think we've done a pretty good job on our campuses, parking lots, sidewalks, and so forth within the county facilities. The issue of snow removal on state-maintained roads and city roads has came up. I've participated in conference calls with the Greenville City Manager over the past 4 or 5 days as to how they're dealing with snow, and also conferring with them in terms of trying to coordinate the best we can in terms of opening and closings. Obviously, we both expressed concern as to DOT's responsibility and their ability to clear the roads through this storm event. Obviously, we've had 2 major factors. One is the snow, and 2 then is the sub-freezing temperatures we've had even the wind chill below zero, which obviously is a anomaly here in eastern North Carolina. But both factors hampered the state's ability to clear the roads. I did talk to the new Division II engineer here in Pitt County, Preston Hunter, on Friday about their progress. And basically, the explanation I got was that due to the extreme temps and the fact that the first participation came down as ice, turned into snow, they said it then froze on the roads. They were then unable to scrape it and remove it. They told me on Friday that they would be concentrating on the primary routes and then focusing to the secondary routes over the weekend. I believe what I understand is they basically just were focusing on the primary routes over the weekend, and then today being Monday, they're getting to the secondary routes. In talking to the city manager, her public works director is going to sit down with Preston Hunter to discuss this event, discuss future events. I've asked to participate in that meeting and probably bring our county engineer, Tim Corley, with me, just to have the conversation and see what future plans are. They did bring in 15 additional resources from the western part of the state. I assume that was plows and personnel, but still we've obviously had issues on the secondary roads. And obviously within the city of Greenville, you have state roads that are state maintained, that are state responsibility, that are state routes that a lot of folks in Greenville probably think it's city responsibility, but they're not. Even though I think the city sometimes will work on those roads because there is that issue there. But I know some of the board members had issues with this. I know Commissioner Webb, Vice Chairman Webb, you might want to express your sentiments.
Yeah, I think that the citizens expect government to act, and I don't know that it's fully communicated, because in the words that we use, we always say county roads. We don't have any county roads. They're just roads that merely aren't in a municipality, but they're all owned by the state. And just for clarification, so that we can be clear about it, Janice, do we have any legal authority to clear a highway?
No.
And if we did take that upon ourselves, would we then be fiscally and legally responsible for any damage to the highway or anything that resulted from us taking that action?
Yes.
And so from here, what I would ask is that, and do we know of any contractors that, because I assume that it's more complicated because roads are graded, it's more complicated than clearing a parking lot?
No contractors to my knowledge.
Okay. But it is different than clearing a parking lot.
Very much so.
And so
Tell me,
basically,
with the parking lot, excuse me for interrupting, but the people who manage that parking lot, like a Walmart parking lot or whatever, they can contract, right, with a
because they own
private
it.
contractor because they own the parking lot. I know that's been going on. So.
and the reason I ask is parking lots are generally flat or on some kind of tilt, but roads do that so that it runs off of each side. And so I just wanted to be clear on our authority, which apparently seems to be zero.
Right.
And maybe that we start reaching out to the state to see if there are contractors that are approved, and if the state's willing to block grant money out or use their emergency fund so that the county can enter into these contracts and then pay it, then they can pay it. Because it is theirs. And as we saw during the budget, somewhere around 13 cents of our property tax rate is caught up in responsibilities of the state that aren't being fulfilled by the state. And so I'd be very hesitant to take on even more state responsibility, because that's just going to cause the tax rate to tick up again, because every time we take an inch, they give us a mile. And we have a lot of miles of highway in Pitt County. So I just wanted to be clear on that, on what we can and can't do. And so when you hear stories about people doing that, they are taking this liability upon themselves when they clear a state-maintained highway.
Yes, and we're
Okay.
talking about almost 1,200 miles of road.
And keeping in mind too, and I know this has been a horrible inconvenience, we average 2 to 3 inches of snow per year. So we've got about 3 or 4 years worth of it in one day this time. So this is not an average thing. But if there was a way to partner with the state, even if it was contracting just to put brine down or spreader trucks or something like that. But again, it's the state's road. The state should pay for it, and in some way for the state to tap into their funds that they have, because they did send, I think, would you say 20 people?
15 resources.
15 resources down here. But I think most of the onus is on the state, and it was, I don't know that they just didn't expect it to happen the way it did, but the state did not fulfill its responsibility to Eastern North Carolina, in my opinion. And again, and
I agree.
but that's just my thoughts on it, is that we were kind of left out to fend for ourselves on this, and then the frustration is directed at us and at the city when I know the city has a lot of highway that isn't maintained by the city; it's maintained by the state, and so they're catching it from all angles as well. Thank you.
When I meet with NCDOT, I'll pass those sentiments along and questions.
Mr. Manager, as it relates to the parking lots, the county parking lots, I received another complaint this morning about the parking lot not being cleared. And I found out from Mrs. Elliott that all of it was cleared but one area. And so I was asked who was responsible or who was liable if the vehicles get hit or blah, blah, blah. But my thing of it is that I think the parking lots for the government were tried to be cleared.
Yes, the staff did a very commendable job. Our solid waste department actually goes out and does all the plowing of all the parking lots. Buildings and Grounds then does all the sidewalks, salt, and sand. Otherwise, like I said, they did a bang-up job, in my opinion. This time, there may have been a portion of some parking lot that didn't get covered, but the far majority, I drove around Friday and looked at the different areas and was very pleased with what I saw.
Because I did get some pictures on my phone this morning, because I tell people, don't complain without documentation, because that's what I need. So,
And we ask staff to use common sense, too, as to what type of shoes you may walk in, and, you don't want to wear high heels when there's ice in the parking lots. Maybe walk in with tennis shoes or boots or something, then change once you get in. Mr. Chairman, that's all I had.
All right, do we have a motion to approve the consent agenda?
I so move.
All in favor indicate by raising your right hand. All opposed, like sign. Okay, who's next, Mr. Manager?
Next, we have Tim Corley. He's going to give an update on the radio and paging enhancement project. We're at a major milestone here as we're near ending stages of wrapping this project up. And we also have representatives from Motorola and Federal Engineering in the audience, and I think Tim will probably make those introductions and let you know who we have here. So this presentation will be by Tim Corley, and we will ask Motorola and Federal to participate, I guess, when and as needed and planned.
Good afternoon, Chairman, members of the board. We've got some good news to report this morning on this afternoon on our radio and paging enhancement project. Really excited about it. You may have heard actually some of the agencies, some of the fire and EMS agencies within the county talking about some of the results from our 700 radio system, which is already up and live. Had some good reports from them. I would like to introduce, Scott had mentioned we have some representatives here from Motorola and also from Federal Engineering, our consultant here, that will be able to answer any possible questions that you may have toward the end of the presentation.
Tim, why don't you have them come up in the front row, and then you can introduce them. Just have them come up in case they need to.
Come on up.
Introduce them as they come up, if you will.
So we've got, first is Michael Manning. He is with Federal Engineering. He's represents our consultant. We have Kristen Diamond, who's with Motorola. Robert Laura on the end here, who is also with Motorola. He's our engineer. And I believe Chuck is he came in today. He's also on the technical side with Robert, answering technical questions that may need to be answered from the board this morning. So we're glad to have them here this morning. So you may be wondering kind of where we are on the project. Well, coverage testing has been completed. There is one item remaining to be completed in coverage testing. I'll talk about that here in a second. As also included in the coverage testing was the 41 test points, which were tested as part of the fire and EMS agencies telling us were 41 areas that they had issues with prior to this project being performed. So we also tested those points. There are some additional improvements that have been recommended by Motorola based on the results, which I'll go over here. Very soon, the pagers will be distributed. We have worked on the templates for the pagers. It's quite a job to just get the actual processes down for changing the paging system to the UHF and making sure that when they are distributed, all the agencies are properly notified by page. Those templates will be completed by the end of this week. We'll have some sample pages done next week, and then the pages will be programmed by our consultant Wireless, who is our local representative for the radio and paging system, and those pagers will soon be distributed thereafter, probably toward the end of January, the first to mid part of February, as soon as they can get them completed. Also, the radios that are existing, that are used by the system, will need to be fine-tuned. That was part of the contract as well, so that will be done. You've received in your package a copy of the executive summary, which was provided by Motorola. As I had stated, the 700 system is up and running. The UHF system will be obviously up and running once the pagers are distributed and we execute that changeover. So I'd like to get into a little bit of the testing portion of what we did. The coverage testing that we performed was the Can You Hear Me Now testing. So as you can see on the map, that I know that the screen is hard to read, and probably the part of your package, that map is hard to read, but it's hard to get the county so you could read it all at one time. But the results from the testing is from the Can You Hear Me Now testing. The county was broke up. You can see the grids on the map was broke up to over 1,000 grids. And each of these grids was driven and tested. There was actually 14 individual tests run in each grid. And as you can see on the map, all those green dots are passing tests, meaning when we said, we called back to the center here, they could hear us, and they sent us something back, and we could hear them. So both the 700 system and the UHF system were tested this way. You can see the map on the screen. The map in front of you is the 700 voice system. 99% of the cells that were tested passed, which was very good. The UHF, which I'll switch this map over so you can see it as well. I will mention as well on this map the purple kind of bullseyes are the actual tower locations, just for a representation of where the actual tower sites are. And the sites where there's the grids which have no shading are ones which were inaccessible. They may have been in a swampland where we actually couldn't get into it. It could have been a heavily forested area. There's a lot of different reasons why those areas might not have been tested. And this is the UHF system. As you can see from the percentage at the top, the UHF percentage was 98%. So we're very pleased with the UHF as well. There is one test remaining in the UHF system, which will be done in the spring. There was some malfunction of one of the test pieces of equipment. The eastern part of that county was able to be tested. The western part was not. That is just one of the 13 tests on the western side that was unable to be tested. We have no reason to believe that there'll be any problems with that test because of all the other tests passing with flying colors, and really the system is performing very well beyond our expectations. To talk a little bit about the where we are as far as funding, initially this was a $5.4 million project. So far we have paid $3.8 million as shown on the screen. We still have system field acceptance, coverage testing acceptance, and final system acceptance totaling 30% of the contract remaining to be paid. And here's where we are as far as change orders. If you recall, we came to you a few months back. We had a change order, actually a credit for the Penny Hill shelter that we're able to utilize for $108,000. We utilized a good portion of those funds for the Aiden structural tower modifications, $97,000. And in our testing, there was, of the 41 test points that were tested, 37 of those passed with flying colors. Everything was perfect. there were 4 areas, Bethel, Gardnerville, Grifton, and Sharp Point, that within the building, actually in the fire station or in the EMS facility, the signal was weak. That meaning that the building itself, at a 13 dB loss, the building was greater than 13 dB. The signal was not able to penetrate the actual building. So in order to rectify this issue, the solution is to put bidirectional amplifiers at each of these locations. The cost of that is $115,024.62, meaning the additional total cost for the project on top of the original estimated cost of the project, $104,385.19. Just as a reminder, the contingency that we allotted, that the board allotted at the start of the project, was over $893,000, of which we'll use $104,000. So we feel like this is probably, the final request to the board for additional funds, but this will satisfy just about every possible scenario for the system. I do want to point out that these maps represent I didn't mention this before, the 13 dB loss. So if you remember in some of the prior discussions, we talked about that loss and how certain buildings, based on the type of construction it is, loses that signal as it goes through the building. So this is the 13 dB loss. We're getting 99 and 98% on a 13 dB loss, which is very, very good. So I want to point that out, that we're very happy with this.
Tim, if I can also interject.
Yes, certainly.
On the contingency, I think you stated it, but I want to restate it. We're very happy that we haven't had to really dip into this contingency as it was designated.
Yeah, we've done everything we can to not have to come back and ask for additional funds, and Motorola has worked very well with us to make sure this project goes through without any additional funds required. So we're very pleased with that. So just in summary, I wanted to kind of give the board an idea of what was left of when this project will be finally completed and actually final closeout. So we've got these. If you approve this change order today for the directional amplifiers, we will install those. The pagers, as I mentioned, will be distributed. There's about 1,200 pagers, I believe, that are part of the system that will have to be programmed and sent out. We'll fine-tune all the radios, and we'll schedule that with all the different agencies to make sure their radios are basically, it's basically a refurbishment is what it is. That's the best way to put it, is that those radios will be basically in kind of the same condition as they would be if they were brought off a shelf and bought off a shelf. So they'll be fine-tuned. And then that additional spring testing we will do when the leaves get back onto the trees. Motorola has been very good about that. They do not expect us to do final acceptance on this system until all these items are complete and that additional testing is completed. So with that, we're asking for approval of the change order number 2 for the $115,000 for the amplifiers, as well as the required budget amendment as part of that.
And Tim, just to interject again, on the last payments to Motorola, we are going to be withholding.
That's correct. Yeah, we will not pay those until the final testing is received and approved and passing. Yes, that's correct.
I have a question.
Yes, ma'am.
I understand that the test tower failure was in Bethel and Shot Point. What impact will it have on the citizen when as it relates to emergencies and that sort of thing?
Okay, let me explain the test tile. The test tiles up in that area were passing. This is the amplifiers that need to be purchased are for inside the actual station. So when we test, can you hear me now, outside the station, it's passed. When we did it inside the station, where you have the building, you have the trucks, it did not pass. All the other 37 places of the 41 that we checked, inside and outside, any structures passed.
What's the clarification to correct that failure from within?
That's what that's what the $115,000 is that
It's
we're
going to
asking.
do.
Yes,
That's what it's set to do.
At those 4 locations.
And then you would do another test after that happens.
Oh yes, that's part of the change order to ensure that it's working.
And the 41 test locations, those were self-identified by the fire and EMS chiefs at a meeting we held. We drew them into a room and said, draw on a map, show us where areas are failing. That's how we identified the 41 test points compared to the 1,250 tiles that we tested and drove into throughout the county.
Yeah, that's right. And Alan Everett and myself went to all 41 of those test points and heard the results ourselves. So just for confidence of that we've made sure that the right places were identified.
And we had some other upper echelon people chauffeuring, I think, during this process, right? Didn't the attorney and the manager?
Yeah, it was a
else?
couple
It was
week
a-
process.
yes, you all-
We
of
had
testing
we
that
had a
to be done.
cross section.
It was quite a job.
From all departments of the county, we asked
Right.
people to volunteer to drive and to assist and to help the county and Motorola and federal to do this. It was a great partnership.
Mr. Webb, and then Jimmy.
When are the pagers being distributed?
It really depends on how quickly wireless. We will probably approve the templates and they're going to provide us with some sample pagers to test for each department. Once that's done next week, then everything is given to wireless to actually programming the pagers. So we're hoping within a few weeks that they can be programmed by wireless. And then there's one thing to distribute the pagers, but another thing, you got to remember, we're moving to a completely different system. So the thought is that even if we distributed them, we've got to go live basically all at one time. And so what we will probably do is we may distribute them in parts, but they will not actually be active until the county, until EMS and 911 decides that it's time. Okay, today's the day, and we'll obviously work with all the agencies to determine what that date is.
Great, thank you.
Jimmy, and then Charles.
Yes, Tim, you have.
Jimmy Charles.
That's okay.
I'm sorry, go ahead.
I just wanted, first of all, I'm very, very pleased with the results I see here. That is outstanding, and I think even better than what we were expecting. And I'm very, very pleased to hear about all of the county personnel that was involved. I'm very pleased to see Federal and Motorola here. But what I really want to know is, how much involvement did we have from our volunteer fire departments and our rescue squad personnel? How much were they involved in this process, and do they understand and support these results?
Yeah, and Alan may be better to speak on that. We did have, maybe half a dozen actually participated in the actual testing itself.
And Alan may want to talk about his communications, you may want to talk about your constant communications and involvement of fire and EMS in this whole process.
Sure. As we've moved through the project, we have made sure to keep the fire and EMS community along with the we'll call it the fire and let's just say the radio enhancement committee, a group that you all put together some time ago to help us through this project. We have communicated along the way each step in terms of where we were, what we were doing, the anticipation of moving forward. So we've kept the group informed. As we moved into testing, we made a point to communicate to the fire and EMS community, hey, we'd like for you to participate. It was during the day, during the week, so obviously there were a number of individuals that could not assist us, but we do have one individual, Chief William Proctor from Falkland Fire, who was with us this afternoon that did participate. So we had a handful of individuals from the fire and EMS community to help us. We'd like to have had more, to be honest with you, but because of their schedules, they were unable to do so. But we did have a handful that did take us up on the offer to go out and assist, and we've heard very positive comments from those individuals, as Tim had alluded to earlier, about the 700 system being online. Individuals are now telling us where previously they had problems with communicating, they can now have communications in those areas. So we see on the 700 side of things, we see that improvement. Fire and EMS community is actually experiencing that improvement. Once we turn the paging system on, we're positive of those same results as well in terms of better communication.
Okay, so if I went to a fire or rescue association meeting, I would hear very positive results about this system from those people.
That's what we've heard to date, yes, sir.
Very good.
Chief
That's what
Proctor,
I-
would you
that's
agree
what
with
I
that?
wanna hear.
Hopefully at the ladies' night event for the Firemen's Association, you will hear those sentiments, but that'll yet to be told.
Good.
True. Chief Proctor, did I say that correctly? Yes, sir. Okay.
Yeah, and we did run into several of the chiefs when we were out doing the testing. So when we were actually at their facility doing the testing at several locations, they had to let us in the building, or, so they've seen the system in action. So.
Jimmy, you recall, I think I've received notices that times were given to these people when they could go and participate in all this. There were several opportunities to have them interwoven, which I think is well taken.
Yes.
Had you finished, Jimmy?
Yes, thank you.
Charles?
Yes, Tim, I have a question for your technical person. And I read the books, and maybe I missed it, but every microwave link has 2 microwave frequencies, correct? Yes. Yes, and it's said to be a redundant link, and you have what you call an A channel and a B channel. When does it switch to the backup channel, and how often is that tested? In the event of a fade, it would switch to the other channel?
Well, the terminology that you're using is typically used in TDMA type systems where you have switching. The microwave system that was deployed is an MPLS, it's IP base, network base. So it uses the MPLS protocol as the main thing that manages the redundancy. So it's configured in a loop.
Yeah.
So there's traffic passing in both directions all the time. So there's not really hard switching like you're familiar with in circuit switch networks. This is a packet switch network, more in line with your network computers.
Okay, because my concern is sometimes in these systems where you have a redundancy and it's called to switch to it, it fails because it's never actually carrying traffic.
Right. Actually, each link that makes up the microwave backhaul was performance tested, and the entire backhaul was performance tested for a period of 24 hours. So each test was performance tested before we put live traffic on it. So and the results were better than expected. So
Robert.
those results are available also.
Yeah.
They're not included in that
Robert,
report.
can you address, we've got 5 towers on the site, so theoretically, if one tower went down for some reason, how the other towers would continue to operate? Or if you had 2 towers go down, how the redundancy works?
Well, each site that's part of your network has 2 pathways into it. Okay, so it's designed for no single point of failure. So if one pathway fails coming in that site, the other pathway carries the traffic, and that's all automatic. It's hitless. You as the end user don't even notice it. We see alarms because of that event.
Exactly, yeah.
But you as the end user don't even experience it.
Right, the technician would say, yeah, that link is
Right.
down. Everyone else says, well, I don't know, it's working fine.
Right.
That's the beauty of that system.
And to date, since we've been live, I've actually had a conversation this morning with my system technologist who's been monitoring since we've gone live. He regularly, routinely monitors the performance, and he was reporting this morning that thus far we haven't had any hits on any path.
Yeah.
So, which is good. I mean, because it's designed for mere seconds a year of outage.
Yeah.
So we're on good track for that.
Thank you very much.
Do we have a motion to approve this change
So
order?
move.
Second.
Any further discussion?
Chairman,
All in,
I do have one question. How confident are we that this bi-directional amplifier will work? And do we know of any other agencies or company that use these and they have been proven to be successful or failure?
Yes, sir. They're commonly used in the industry.
Can you go to the microphone?
The bidirectional amplifier equipment we're talking about, it's pretty commonly used. So it would be designed up front for that specific building. It'd be a solution specifically designed for that. And then we, as was said before, after it's put in, we would test it and make sure that it met those requirements. So yes, it would cover that building.
And if it does not meet the requirement for some reason, what would be the next course of action?
If it were not, well, it would be as part of our contract and the change order to meet the requirements.
Okay.
Like we said earlier, we're still withholding funds from Motorola, so we'll make sure that everything's working per the contract
Exactly.
before they're paid the final payments.
Right. Okay, thank you.
Any further discussion? All in favor indicate by raising your right hand. All opposed? So ordered. Okay, I believe, Tim, you're now, but has the board read this easement and access to Greenville Utilities? Or do you need
Yes, Mr. Chairman, and I would move that we approve this.
Is there a second?
I second it.
Any further discussion? Not, indicate by raising the right hand. All opposed? So ordered. Okay, Mr. Rhodes?
Well, here we go again.
Mr. Chairman, we have an item that's been before you a few times already, and we're bringing it back today because of a deadline that was not met in mid-December. So to give you a little recap, this is the sand mine that you've dealt with that's located on Shepherd Mill Road near Wards Bridge Road intersection. You may recall at your August 21st meeting, you did allow an additional time extension of 120 days to completely restore the buffer area. You may recall some of the excavation activity had encroached on adjacent properties, plus it traversed the 100-foot buffer that's required per the zoning ordinance. As of that date and the map that I'll show you in a minute, you'll see that requirement had not been met. Just to give you a full recount of where we're at with this particular project, mining operations on this site started back in around 2008 when the first conditional use permit was issued. That was for the rear portion of the property. When we were out there early last year in 2017, we had been called out because of some noise issues, and we realized at that point with an additional inspection of the site that there was some encroachment of the 100-foot buffer areas. That was brought before you in April of last year. You advised staff to conduct a public meeting out at Pactola School. We did that, brought it back to you in May, and at that point you did conduct the public hearing, and you did grant the approval of the conditional use permit for the front portion of that site where they'd already begun excavation, but you gave them 60 days to restore the buffer. We went back out on site, had a map submitted to us, indicated that the buffers had not been restored. Some work had been done, but had a long way to go. At your public hearing in August, you agreed to another 120-day time extension to restore those buffers. We were back out there in early December, got a progress map I'm going to show you in just a second. And bottom line, the deadline date of December the 19th to restore all the buffers was not met. So this is our first map as of July when you first dealt with this time extension. And you can see a lot of the area here. This is a 100-foot buffer, a faint dark line, this dashed line here. Everything that's between that, this is an adjacent property. You can see there was some encroachment onto that property. Large section here, another large section along this area running out to Shepherd Mill Road, which is located here. Here's the latest map that was provided, and the area in red now still encroaches within the 100-foot buffer. The good news is none of it extends across the property lines to the adjacent property owners. There was a bit here that went across the line. That's been restored. An area up in this part of the mining operation also had crossed the property line. So a lot of work's been done, not fully completed as of yet. However, I do understand, and talking with some of the members that are here in the audience today, they feel like the work has been completed now. So with that, Mr. Chairman, you've seen our actions that we've suggested for this particular one. You've got a couple of recommendations, a couple of options, or possibly both. And the first is to consider yet another time extension. Staff believes this would be another major
change to the conditional use permit would necessitate a public hearing. That would need to be had in February. The other part is to go ahead and advise staff to move forward with some enforcement remedies, specifically fines and penalties. And, of course, our ordinance, and our attorney can speak better to this, we can go back to the date that it was first detected. That was 11 months ago to the day. $50 maximum penalty per day. So you're talking close to $17,000 if you maxed out. We're not necessarily recommending that today. We are seeking compliance, and they are gaining a closer proximity to that full compliance. So with that, Mr. Chairman, we'll welcome any questions or comments you have.
James, you mentioned your map. Put the last one back up you had.
Okay.
Did I understand you to say that work had been done by the owners that you haven't been out and seen? Or did I miss?
This was the, you can see this was 4 days prior to the expiration date, and you can see in red was the area that was still. But I have not been out there since they now say that it's been completed. We would like to have a map absolutely showing that that's been completed.
Now, are they saying then that they've got a map to show that all of that red there has been completed? Is that what they told
In
you?
talking to the surveyor, it'll be a couple of weeks before they have that in hand to us.
I think we don't.
Beth and then Mary.
I'm not sure which way I want to go with this. I know that I am surely concerned at the number of times that opportunities have been offered to remedy numerous problems and concerns. And it bothers me that we started in 2008, correct?
Correct.
And there was a good amount of time before we were even aware that there was a concern, and our citizens who live right there were the ones who had to come and tell us that the encroachment was going on into their property. And we've had the people from the mining company here twice, I think, correct? At least twice, maybe more than that. We've had the people who are supervising this here, and we've had lots of promises and statements in writing of what was going to happen and what they were going to be able to do. And then we come back, and there's been a lot. There was rain. I can't remember what some of the excuses were, but I remember one time they came back and nothing had been done. Then the next time we came back, and they couldn't because of the weather or whatever. Anyway, this has been going on a long time, and I'm kind of feeling that there needs to be some kind of penalty. This was supposed to be completed December the 19th, and I don't remember what the other deadlines were that we had given, but each one of them we excused and we excused and we excused. And here we are again with a deadline that wasn't met. So I don't think the penalty should be the maximum, like you said, but I think there has to be, if we're going to continue on with whoever's supervising this and whoever is seeing that it gets done, if they're going to continue being the ones who are in charge, I think there needs to be some type of penalty so that there will be an alertness of what needs to be done for these citizens in Pitt County. And that's just kind of how I feel about it.
Thank you, Beth. Mary?
I am really disgusted at this company. They've disrespected residents in the area. They've disrespected this board. And I think that we should take a stronger look at what they're doing to the residents in the area. They're disregarding anything we've said. They've not paid attention. And I really think we need to take a stronger stance against them. We need to protect the citizens. They came to us. They brought it to us. They invited us out there. I went to see, and we need to take a stronger stand on their behalf. We're the ones who who manage and govern their taxes. And that's why they pay them. And for them to not do as the deadline said, what need to set them? Where do we take a stronger stand? Are we going to keep on easing what we say? I'm very disgusted in that they've not respected this board, nor the deadlines that we've set. Thank you.
Thank you, Mary. James, you say this map here, progress map 2, was, you made an on-site visit December the 15th, is that correct?
Actually, earlier in December, and this map was pretty much the result of that after a couple more weeks of
All
work.
right. Now, since then, get back to the point I asked you a while ago. You have been told by a surveyor or engineer that they have done some additional repairs?
That is correct.
But you don't know what they are, do you?
I have not been out there.
Do you think from your investigation that you've done that you need to do that before you make a recommendation to us?
What I prefer, Mr. Chairman, is exactly what we have on screen is pretty much a completed map showing us a lot of these areas. I, as a staff member, wouldn't feel comfortable going into some of these areas to measure it. We need an as-built or an as-completed map from a surveyor that shows everything's been restored. So I would say we can bring, my recommendation is, let's go ahead, set a public hearing in February at one of those 2 meetings. Let's get that map in hand, and let's make sure that everything's been completed and we can go from there. The big issue we want is to make sure we've got compliance, and I can't tell you that today.
Thank
you. Mr. Garris, you were going to say something?
What, do they give any reason for not meeting the 120-day deadline? I mean, I thought we were extremely lenient on the 120 days. Commissioner Perkins-Williams made the motion, and I seconded it. I was totally supportive of that. But I am very, very disappointed, as has already been expressed, that this wasn't done. Why wasn't it done according to what we requested?
The operator's here. I'd rather for him to express some of the concerns and delays that he's experienced. So if you'd prefer, you can hear it straight from them.
Well, I'm interested in knowing why, because again, I'm of the opinion that if it's not a really, really legitimate reason, then we need to start issuing penalties, because there's got to be consequences to not abiding by the standards that this board sets, especially when we were giving them an extension.
Is there anyone here that wants to speak to the issue that Mr. Garris and James just brought up?
Joseph, I look after operations at the mine site. Basically, our mining company is a family-owned business, and we're small. So the funding for the replenishment of the 100-foot buffer has to come from profits coming in from the business, which means we have to operate our business as well in the meanwhile of doing repairs. We only have 4 employees. So while we're making products to be able to sell, to generate the income to fund the 100-foot buffer restoration is where we run into a problem. So we have to kind of allot time to operate our normal operations as well as operate the restoration of the 100-foot buffers. The map that was done on the 15th by Mr. Richardson, basically what it is they pull the tape from property line out 100 foot. The map is correct, but what it didn't reflect was the stockpile of material that was there to push out to make the 100 foot. So yes, the map is correct, but also it might be a little deceiving now that we've gone and sloped the banks and whatnot. The 100-foot buffer is pretty much completed. That map was done the 15th. We worked every day, after the map, and honestly, we worked right up through Christmas to get it done up until the snow. So,
can your engineer or surveyor or whoever this person is that James alluded to have information by, James, what dates are you talking about?
Either one of your next two meeting dates, February 5th, I would say the 19th, to make sure we get the public hearing noticed appropriately.
Well, I'd asked Mr. Richardson, and he's here. I think he said it would take another week or two for him to get to it, so I don't know.
Well, I'm just speaking from the the feelings I'm getting from this board now. You're gonna have to do something. And that's gonna have to be done by, February 19th. Is that what the board is saying?
I think that's being lenient again, yes, that's what I'm saying, but, I mean, I would agree to that. But what I don't understand is the work that you did from the 15th until Christmas, why wasn't that done before that in a more spread out area?
We've been working on that all through the summer. The summertime is a busy time for when we sell our materials. So during the summertime when it's hot, we're constantly trying to produce products for the companies that we sell our products to, such as the concrete companies and whatnot, mortar, construction. So it takes a lot of our time during the summer months to produce the products that we sell in order to generate the money for us to spend on the restoration of the buffers. It's either that or
appears to me.
Well, it's either that or either go broke and I can't repair it.
It appears to me that the answer to my question from you is that your primary emphasis was on the operation of your company, not the deadline that this board had set. And to me, it would appear that the most important thing for you was to meet the deadline that this board has set, because this board has the authority to impose penalties, has the authority to revoke your permit altogether. So it looks to me like that would have been the number one priority, and also that would have been the number one priority for the public relations in the community, to know that you had met the leniency that this board had established for you.
And that's correct, but it's like I said before, if I'm broken out of business, I can't do anything. So I have to generate income to be able to function to do the restoration.
What's the feelings of the board?
But in any sense, the 100-foot is pretty much done now. So.
But it wasn't done in the required time that this board established for you because of mistakes your company had made in encroaching in the beginning.
Thank you.
Encroaching in the 100-foot buffer.
Yeah.
Mr. Chairman, if
I believe the manager wants to make a remark.
Yes, if I can ask James or the operator, what % of the area that was in non-compliance has been brought into compliance to date? Or what % is left to be brought into compliance, would you say?
I have not been out there. I'll leave that to your discretion.
Ask the question again.
From the date of non-compliance, what % has been brought into compliance? Are you at 50% of what the board asked you to do? Are you at 90%? Are you at
I'm over 90%, if not completed.
90% not completed?
Yeah. I bet 90% completed or 100%. I'm saying I'm 100% completed with the 100-foot buffer now.
But here, this is probably, the red on this map, as of this date, is probably showing, what, 10 or 15% that's not completed? But you're saying subsequent to when this was done, you've done additional work and you're...
Because this was done the 15th, and I think the deadline was the 19th. Because like I say, the red here, basically there was material there stockpiled, but if you measure from water to the boundary line, I don't know what that is, 72 feet at one point there, but there's material already there to be pushed over to make the 100-foot at that time. But the surveyor only measures from water to boundary line because that's what he's paid to do.
Mary?
Mr. Chairman, I think that this situation has the idea that appears to me that they're banking on the fact that we're going to be lenient every time, continue pushing back, and continue going without taking a stand. It bothers me. It really does bother me, and my element of trust in what they've told us has eroded. That's my opinion.
Bill?
We're in the ditch with you, is the bottom line, and we've been in it a good while. What may be the best thing for us to do is to do an extension with James's crew checking and making sure everything is where it should be. And as we requested, before it comes back here on what, February the, what'd we say? 19th.
He said.
But I'm not sure that we shouldn't not revoke the permit, but levy at least some penalties for not getting close to where we had expected it to be. And I don't know if this was appropriate, Madam Attorney. And I'm not looking at whatever he said every day, 7 days a week, you know, going back to whenever. But certainly the 120 days. And then we met that deadline and we were not where we were supposed to be, or according to Mr. Rhodes. So I'm not sure, and I don't know how many or how much or whatever, but I feel like there's a room there that there should be some penalty.
The deadline was the 19th, correct? The deadline was the
But we don't have verification that it was finished from our
Oh, it was
group.
finished.
May I
I mean, you don't have
clarify, just
verification either or.
Just procedurally, legally, in order to grant the extension, you have to have that public hearing. And so the setting of the public hearing would put into motion consideration of your extension, so you would not have the authority to grant the extension today. That would only be following a public hearing. As to the imposition of fines, the ordinance that this board adopted sets forth a process for those imposition of fines that requires a notice to be mailed out by the planning director and a process that's followed to demonstrate the amount of the fine. So the action the board would take today, if you wanted to pursue the fines, would be to direct the planning director to follow that process in the ordinance. This board would not set the amount of the fine or impose the fine today.
Jimmy.
If we grant this extension, we got to have a public hearing.
Correct.
Now, while we are waiting for the public hearing, does the mine continue to operate as normal?
Yes.
We're not.
Well, I just think that there's got to be some consequences of not adhering to the requirement that this board set. If we don't, if there are no consequences, then everybody out there will say, hey, don't worry about it. You know, they just say they're going to impose a fine, but they don't ever do it, so don't worry about it. And I don't think that's the message we need to be sending.
But we're currently not selling any material out of this site. The only reason we're in this site is for screening off material and to fix the 100-foot buffer. We're
Madam
finished
Attorney.
digging at this site.
What about, is it the possibility of a performance bond as condition of going ahead and setting the public hearing for February the 19th? You understand what I'm saying?
Question is, could you require a performance bond pending that?
Yes.
That's not within your ordinance.
Okay. I was just trying to find some workability.
See where you're going. But no.
Madam Attorney, legally, what can we do from this board legally to assess some type of penalty?
So you really have three options before you. One is to set a public hearing to consider a further extension. Two is to consider revocation of the permit altogether. Three is to impose some fines. And if you choose to impose some fines, then you would need to direct the planning director to follow the process in the ordinance, which means he's got to send out a notice of violation and an amount of a fine, give a period of time within which for that to be paid, and to accumulate those based on the demonstrated noncompliance. And so those are really your options, and you can do more than one of those options. You can set in motion the setting of a public hearing for the 19th, if you choose to do that. At the same time, you can direct the planning director to pursue the imposition of fines and report back to you what that process has reaped. And at the same time, you can put the owners on notice that at the time of that public hearing, you might decide that you might even want to revoke their permit altogether, and then you can reconsider the entire matter at that time. You can do any one or a combination of those things.
Mr. Chairman?
Yes, ma'am.
I'd like to make a motion that the February the 19th public hearing be in place. Between now and then, I would like the staff to look into some form of fine or penalty that they may bring back to us. And we're not talking about one time not meeting expectations. I know 3 at least, and promises were made each time, and I mean, we had people from wherever, whoever it is, it's your operation, but that has been down here from wherever they were down here from, and they've heard the same thing, so that's my motion.
I'd like to second that, Mr. Chairman.
All right. You've heard the motion. Is there any further discussion? Excuse me.
In your motion, you say look into, but do you mean to set in motion the plan?
I want them to come back with a recommendation for a penalty and how much of one and for what period of time.
So what we would do, given the board's approval, would be to send a notice of violation with an amount of a fine.
Yes.
And that would go out to the property owner. We could then come back to the board with advising that the notice of violation was sent, that this was the fine, and then this board ultimately could dispose of that fine how it deems appropriate. You could say, I agree that 100% of that fine, and we'll go to the max, because as staff, we don't apply that discretion that the board would have. So if arbitrarily the number was 17,000, James Rhodes would put in the process for the notice of violation, the imposition of all of those fines. There would be an opportunity to pay them. If they paid those fines, then it's done. If they did not pay those fines, then it comes back to this board, and would come back to this board either way to say, we've issued the notice, these are the fines, this is what's outstanding. This board may decide at that point that we need to enforce collection on that full amount of the fine, that some different amount is appropriate, or you may find that there have been maps submitted that demonstrate to your satisfaction that the entire buffer has been restored, and that the fines ought to be waived based upon the fact that on this day, an engineer or surveyor certified that the entire buffer has been restored in accordance with the board's directions, but only a certain amount of time later than anticipated. So we could do that.
So there's an option for going to max, bringing it down, reducing it way down, and once we meet and hear what has happened, we can say no fine at all or change it to a different amount.
And then in the meantime, if I were the owner hearing these consequences, I would be absolutely certain that well prior to any public hearing, that there is a map that shows 100% of the buffer is restored, because that will certainly set the tone for your next consideration.
Well,
Is any
my
further
motion was okay with that.
Any further discussion? If not, you understand your motion? All in favor of the motion indicate by raising your right hand. All opposed, you got that count?
Yes.
Okay.
Unanimous.
Thank you.
Yes.
All right, next, Janice, is that you?
Yes, I've included materials in your packet that are a resolution declaring the opioid problem in Pitt County to be a public nuisance. Also in your packet is a engagement agreement to engage the legal services of McHugh Fuller Law Group to pursue litigation against various drug distributors and drug manufacturers in order to recoup damages sustained by the county as a result of this crisis.
I like that.
Here to answer any questions you may have. The action that would be requested would be approval of the resolution, or action recommended is approval of the resolution and authority for the chairman to execute the engagement agreement that's in your materials.
Yes, Mr. Chairman.
Yes, ma'am.
I'd like to make the motion that we approve this, a resolution.
I second it.
In discussion
Now,
on,
in approving the resolution, does that also include
Yes.
moving forward with the lawsuit?
Yes,
Okay.
The
The
motion
engagement
for what's
agreement
in
as
this,
well.
in this,
Putting our name on the.
putting our name on the sheet.
all right, you adding to your motion, and your first motion was just said the resolution, Mary.
Oh, I'm making the whole thing a part of my motion, Mr. Chairman. I'm so sorry.
Okay. Because
That-
I was gonna vote for you on the resolution. I got some questions about the second end. All right, any further discussion?
If you would like, then we can take it in
No,
part,
well,
but I like the whole thing.
all right, good. All right, any further discussion? If not, all in favor of, the resolution and the employment contract, that's your motion, Mary?
Yes, sir.
Indicate by raising your right hand. All opposed? All right, that's got it.
Thank you, Mr. Chairman.
Okay, the next one, Mr. Manager.
This next one, Jordan Smith will follow up on the request to draft a drone ordinance for Pitt County, and you've got that in your packet, and Jordan's going to address that.
Yes, so thank you, Mr. Chairman, members of the board. I was before you in December to discuss a potential for Pitt County to enact a drone ordinance. And in December, I presented to you a model ordinance prepared by a group out of California. You gave staff direction to prepare a ordinance tailored to Pitt County. So that's what's included in your packet today. If the board chooses to proceed with adopting this, it's being recommended that you hold a public hearing at your February 19th meeting.
I have mixed
And that's
emotions about it.
all I have. Be happy to try to answer any questions you may have.
Yes, and at this public hearing, if somebody wants to come forward and get assurances that this does not apply to radio-controlled aircraft, such as there's a club out there in Farmville, and I think in Pactolus, he could be given assurances that it's not going to apply to radio-controlled aircraft.
I'm not sure. I think under the way the ordinance is defined, it would apply to any unmanned aircraft, and I don't think it, as in the current form, has any distinction about radio
we
controlled
probably
or not.
got to go back and touch base with the FAA, because when I was hearing their representatives, those are two different things, RC aircraft and drones. So we probably are going to need to cut a finer line between those two.
A strip down in Pactolus area.
All right, what's your pleasure?
So is the person who's recommending that we, Commissioner Farley, that we go back and look at that before we consider this one as it is?
My take under the ordinance as it's drafted, it would apply to drones and RC aircraft. If the intention or the pleasure of the board was to create some type of distinction, then
Yeah,
we can explore that.
We really don't have any trouble with the RC clubs, the radio-controlled aircraft, and I know from listening to the FAA representatives, I posed this very same question, and the FAA and the contractors said, no, the radio-controlled aircraft could be misconstrued as being a drone, but it's not per se a drone, so we need to use your legal skills to cut a finer line of distinction there. Because myself, I wouldn't vote for it like that if someone can make the argument that it's going to limit his model aircraft club, and that's a very responsible bunch of people.
Charles, are you saying then you want this to be reworked and brought back to us?
Yes, please, I would like that.
Is that, the board give consensus to that?
Yes, sir.
Yes, sir.
All right. Anything else on that issue? If not, then we will move on to number 6.
Number 6, your appointments to the Pitt County Board of Adjustment. As you recall from last meeting, you had 2 members, Faye Barefoot and Lee Ball, who seeks to become moved up from being alternates to regular board members, and now you need to appoint 2 alternates.
Mr. Chairman,
Yes, sir.
I would move that we appoint Ashley Moore and Donald Rhodes.
I second that if there's appropriate to second it.
Well, I don't think you need one, but no further people mentioned for those 2 positions. All in favor of 2 presented, raise your right hand. All opposed, so ordered. Thank you.
Okay, just as long as Joe is still on it, so she's still on it.
Anything else? Melvin, you got any comments?
Happy New Year to everybody.
There.
I look forward to working with you all in a peaceful and happy manner.
No comment.
No.
Oh, as far as I'm concerned, we're adjourned, sir.
Jimmy?
Well, I do want to invite commissioners and the listening audience to the Unity Breakfast that's held annually. That is, will be on the 15th at the Murphy Center. Other than that,
Are you making a motion then? Motion to adjourn?
So moved.
I second
All
it.
right, all in, raise your right hand. So ordered.